We have Dr. Janze here from Embody Hydration. How are you doing, Dr. Janze?
I'm wonderful.
Great, great, great. So first, before we get into the other part of the show, let's do the check-in. How have you been? How's everything been since the last time you've been on the show? All that good stuff.
It's going good.
Okay.
We've started our campaign with the weight loss program, the
Mm-hmm.
new and improved weight loss program. So,
Mm-hmm.
been doing our call to action just to get, let people know that we're here, what we're doing, to get on board so that we can help people, live healthier lives, lose
Mm-hmm.
weight, and feel great.
So how many? Not even. I won't put that number out there. So do you still have spots for people to join?
Absolutely.
Okay, cool. I didn't
Yeah.
want to put out a number, but yes, how do you still? So let's talk about weight loss real quick, since that is the theme in the campaign for the month. Excuse me. When we are talking about, because you have videos out talking about, it's not a quick fix. Things are not a
Right.
quick fix. Like there's a process, the mental side of this. When we are talking about weight loss, and you actually have the injections, right? You have two of them,
Yes.
correct?
Yep. Yep.
When we're dealing with this and talking about actually moving forward, and we say, like, we get to a consultation with you and we talk about
Mhm.
moving forward, what are some things that we need to do with ourselves or check with ourselves to assure that this process is done in a way that we can see results, but also in a way that can motivate us? Because mentally you can lose the battle if you think that this is like a magic drug and it doesn't happen that
Right.
way. You know what I mean? So
Right. Right.
what are some things mentally and emotionally that we may have to check when we're getting into this process? And I'm about to bring Kim in right now.
Okay. And two, I have a patient too that is willing to come and share
Is she
his
with you?
experience with us. But so when you come and do a consultation with me, the one thing we do talk about is all of the things weight loss, like all the options, not just the injectables. But
Mm-hmm.
we also talk about the other things that we can do in addition to that.
Mm-hmm.
But weight loss, I always, tell people when you start these injectables, it's not an overnight, you lose 20 pounds in 5 days. It is definitely not that diet. So I set that standard in the beginning
Mm-hmm.
during that conversation that it is a much slower weight loss. So you may lose between 1 and up to 5 pounds in a week,
Mm-hmm.
which is okay. But that slower weight loss is really what you want. And so we're in a culture of let's get this weight off quick, but
Mm-hmm.
that quickness, obviously, it hadn't worked for you, hadn't
Mm-hmm.
worked for me,
Mm-hmm.
and doesn't really work for a lot of people, especially if you're not willing to stick with that, what you're doing long term.
Mm-hmm.
But it's that quick mentality of let's get it done quick. So
Mm-hmm.
I always set the standard that it's not that quick weight loss. It is that slower weight loss that you can sustain longer. But
Mm-hmm.
also, I do let you know that this is not just the one thing that you need to do. You need to incorporate exercising, eating better,
Mm-hmm.
and also talk about meal planning options of one that's that's pretty much it always works for most
Mm-hmm.
people anyway. So I do, like I say, set that standard in the beginning. And then I always encourage them and let them know, listen, you're not doing this alone. I'm here with you. I'm right along with you doing the same thing. And
Mm-hmm.
so just trying to get that paint that picture in the beginning. I think it's important.
Mm-hmm.
And then with the new program, it comes with a monthly check-in. So it's still having the accountability piece. But I always tell people, if you have questions, of course, don't feel like you're out there by yourself because you're not.
Right.
And
Right.
so that's why we created the Embody Transformation Tribe Facebook group that's exclusive just for the weight loss patients, because that's another added piece that will allow them to not feel like they're on this island alone trying to lose weight, trying to figure it out.
Mm-hmm.
But you have that community. You have where you can get meal plans for the week. At
Mm-hmm.
least, you don't have to follow it to a T, but at least it's a guide to help you be successful along the way. And
Mm-hmm.
so, and then of course, that other piece to that, the weight loss program is the 10-week healthy living guide that gives you all the things. Allows you to journal. There's a food list in there. You can also meal prep for the
Mm-hmm.
week,
Mm-hmm.
make your meal plan, and then keep yourself like measurements, your weight, so you're able to keep all of that into one little book. But it also gives you things and tips that will help you along the way, like stress level, hydration, caffeine, foods, exercising. So
Hmm.
it's a really complete guide to help along the journey of weight loss. And so that's a part of that new weight loss program. But like I said, I set the standard up front to say, hey, this is not, let this not be a one thing that you just do. But also, let's start this a little slow. So let's start with the injections, and then let's incorporate, drinking more water. Let's incorporate the next thing. When it comes to exercise, you don't have to go out and purchase a gym membership per se. If you want, that is fine. I don't push that, but I do have like people, member gyms that I can
Hmm.
refer. Say, hey, go to this because I know this person. Um, but, incorporate something, especially when it comes to affordability.
Hmm.
Walking, parking a little bit further. So kind of stair stepping what you're doing in your program to kind of help guide you along the way and not trying to do everything up front because it's stressful.
Hmm.
And then it messes with your mental status, your mental health, because you're stressed out trying to worry about I need to do this, I need to eat this, how many calories, so it's a lot of things that go into play. And
Hmm.
so I just try to encourage one thing at a time, and that way you're generally going to be more successful in the end.
Cool. And it looks like your guest is here,
Yes.
a gentleman by the name of Steve. So we're going to bring Steve in so that we can continue the conversation with brother Steve.
All right.
What's up, sir? How you doing?
I'm great. How about yourself?
I'm doing well. I'm doing well.
I'm sorry, my phone too loud, so I can get the feedback. Um, I'm doing great this evening. How about yourself?
Good, good. Nice to meet you. So
Same.
you are currently getting the injections, or have you been on the injections or the shots or any of that, or what
Yes,
services do you
I'm
have?
doing the injections,
Hmm.
and I've been doing them. I want to say since 2023, a little
Hmm.
off and on. I started once I finished up my last surgery. So
Okay.
just to kind of give you where I'm with that, 2020, I had bad accident, car accident where I was hit in the rear. So I've had 5 surgeries since 2020 up to 2023, August
Hmm.
of 2023.
Hmm.
So with that, I put on a lot of weight. I put on about, I want to say about 35 pounds, I think. A lot had to do with the medication I was taking. And on top of that, I'm a diabetic.
Hmm.
So the diabetes, I am diet control only. So, but with the meds, it throws all your numbers off. It throws your sugar numbers levels off, your A1C. And when I had my surgery in August of 2023, they weigh you before you go into surgery, and I was at 240,
Hmm.
which is a lot for me because coming up in school, I was
Hmm.
195 at the most.
Okay.
But putting on that 35 pounds, man, it was really hard. Not sleeping well, and I really didn't have much of an appetite. But just because of the meds, the steroids, of course, it makes you want to eat constantly.
Hmm.
Mhm.
But with that, after the surgery, I was like, well, once I come off these meds, I need to do something to lose weight. It happened to me a while back. I had an incident at work where I messed my knee up and I was out of work for 2 years. And I put on that weight. So I knew how it felt. And
Hmm.
I didn't want to go back to that. I didn't like the way it made me feel.
Hmm.
So getting with Dr. Janze, with Doc, I told her, say, listen, once I finish up with these meds, I get released. And I think it was like late December going into January when I actually just stopped taking the meds. Because again, it was just making me feel awful. When your A1C, for those, if you don't know, when your A1C is high and your blood sugar level is high, you have no energy, you want to sleep all the time, you feel tired all the time. So with this, hearing about it and listening to the other clients, patients, I guess you want to say,
Hmm.
and understanding what they were going through and knowing what I was dealing with. And it was important for me to bring that weight back down, not just for the health reasons being a diabetic, but just for overall wellness, trying to get back to some normalcy after the accident. Cervical fusion and 4 shoulder surgeries takes a lot of you. So I don't really get to exercise. So I'm trying to figure out how I was going to lose the weight. So this was a plus. I started out with semaglutide, and doc switched me because of the side effects. Wasn't really bad, but I dealt with, nausea. And of course, after coming off the meds, that's the last thing I wanted. So she switched me over to tirzepatide. Let me slow down. Once switching over to that, I noticed a difference in how I was feeling. I seen it in my clothes before I actually seen it on the scale. I'd say over 6 months, I lost, I want to say it was 22, 23 pounds. I went to the doctor last September, and all my numbers were great. After the surgery, before getting on the weight loss and doing the tirzepatide, my A1C was at like a 6.7, 6.8. And again, my weight was up to 240. So when I went to the doctor last September, my A1C number was down to a 6.4, which is good. I'm still technically considered a diabetic. My sugar level or my numbers were back down to somewhat normal, like a 104, 106. I felt better. I was sleeping better. I wasn't as tired when I get up in the mornings. And it was a real help. Real help, especially dealing with the shoulder. How can you really lift weights? Or I can't even tell you the last time I went running or jogging on a treadmill. Just because of the jarring in the neck, and it's a mess. It's all over the place. But Doc was a great help. She got me straight. She got me on there. Told me how to change my eating habits, change my diet. I'm not really good with meal planning, but I tried. It was helpful. But needless to say, though, I was able to get in some jeans back into some jeans that started to feel tight in the crotch and around the waist. It was to the point where I really didn't have to use a belt. But I do have a belt that I still have that I want to say I was maybe 2 to 3 holes from the tip of the belt. I got to the point where I was able to tighten my belt till I was down to the last hole, and it was still loose. So for me, that was a win. I still haven't gotten rid of the belt yet because I want to keep that as a reminder. If that hole moves back up, then I know I'm doing something wrong.
Right.
So, I love my sweets. But the one thing with the tirzepatide, I will say, in changing your eating habits, it lets you know what your body doesn't like. So I've cut out the chocolate candies. I love Snickers. Cut that out. Fried foods, body don't like it. So I cut that out, which is helpful because then it helps me change my diet and the way I eat. And I watch what I do. So, with my job, I drive a lot, move around a lot, travel around the city a lot. So I really don't eat once, maybe twice a day, which is not really good for a diabetic either. But, I do what I can. But it helps me keep off the weight with the tirzepatide because it controls my appetite. Other than that, Doc, she's really been helpful with keeping me on my meal plan. Trying to anyway, as men, we can be kind of stubborn when it comes to that. I seen the podcast when you was talking to the nutritionist, and she was saying, "Oh, you got to cut this out." And I was with you. I was like, "Oh my gosh, me too. I got to stop eating that." Oh my man, what am I going to do? So, it's a lifestyle change, but you feel better as you go. Keeps you healthy, especially those that have underlying medical issues, be it serious or not. And you need to lose that weight. It's a great help. I promise you it is.
So before you even got on the shots, because I know you said that, you had gained some weight from medication and things like that. What were some of the things going in your mind prior to the shots? Because I know some people are like, I don't know if I want to go that route, or, you know, what was your come to Jesus moment for you to be like,
When I weighed before surgery, and they told me I was at 240 pounds. I'm a small guy. I'm about 5'11". I say after high school, working up to 2000 and I think 2011, before I had the injury to my knee, I was at 195, comfortable, you know, nice size. I wasn't really cut up, but I was solid, and you know, try to keep in shape. And when that happened, I swole up. I went from a XL shirt to a 2XL. And I noticed that starting to happen again with my shirt. I had XL shirts where they started to fit like muscle shirts. Didn't need that. So that coming to Jesus moment was that when the doctor said, "Oh yeah, you're at 240 point something, going on 241 pounds," I knew that was too much. And you know, it was kind of hard to tell exactly how I was feeling because of the weight, because of the meds. You know, I'm taking pain relievers, I'm taking nausea medicine, I'm taking stuff for headaches before the headache come on, but after the headache, that type of stuff. So the oxycodone and the gabapentin, just stuff that really affects your mood and how you feel. So once coming off the meds and knowing that's the weight I was at, I knew it was time to make a change.
And when you say that the tirzepatide kind of let your body know that, you know, certain foods didn't work well, can you tell us more what you mean by that?
So with the semaglutide and the tirzepatide, so with changing your eating habits, I guess by suppressing your appetite, which I can tell you the specifics of it, but it's just your body lets you know what it doesn't like with the meds. I guess like certain things, you know, they tell you don't drink milk with this med because it could affect your stomach or whatever the case may be. So I began to notice trying to make these changes in my diet with not cutting out certain foods, but I still would eat certain things. Of course, you know, like I said, I love chocolate. So, you know, I ate a Reese's cup and I was just like, it made me feel ugly. So I was like, I need to cut back on that. You know, I love Chick-fil-A, their fried sandwiches and the chicken sandwiches. And I was told that the peanut oil is actually not bad for you, but the fact that it's fried, it just wasn't agreeing with my stomach. So I was like, okay, I need to stay away from that. So having to adjust. So it's almost like it makes you make that decision that, hey, this is not good for you, so you need to change. And having that as a, how can I say, as a catalyst, so to speak, to let me know I don't like it. You might not want to eat that. Find something else.
Did you notice that your body was reacting to like the time of day when you were eating? So like if you ate too late or maybe if you ate like too early, how did things go as far as the latter part of your day?
So for me, I've never really been a big breakfast person, but I would eat a little something or maybe drink like a protein shake just to get rid of the hunger, and I was good. Didn't really have to worry about it. During the day, you know, if I'm in the office, they'd be like, "Hey, what are we eating for lunch?" I'm like, I really don't have an appetite. So they're like, "You're not gonna eat today?" I'm like, "Yeah, I might eat later on, you know, and I might eat on my way home around 5:30, 6 o'clock." So around 8:30, 9 o'clock, I'm really not hungry. So I would find something else, maybe some fruit, another protein shake, maybe, and I'm not really hungry. So of course, not eating after that time, of course, you wake up in the morning, you're gonna be hungry. So again, the substitute for me was the protein shake.
Okay.
And then Dr. Janze, question for you, because there are people who, you know, are diabetics on the medication. So how likely is it that with them using the weight loss injection that they can be weaned off of their diabetes medication?
So it depends. So as Steve talked about the A1C, and so that along with me starting you on the weight loss program, actually I do lab work, or if you've had labs, I can use that from your primary care doctor. But I collect lab work so that we'll know at least baseline where you are with your A1C. And your A1C is basically a 3-month average of where you are with your blood sugar levels. And so patients that are on insulin already because of diabetes, and I can speak to one patient in particular. I have on, she started with me on tirzepatide and she's already on insulin. And so I dose them the exact same as I do with anyone else. But I do also make sure that they're mindful because this can lower your blood sugar. So make sure that they're eating enough, eat enough protein, especially. But still, we follow the same diet guidelines. It might be a little bit stricter because of course, the diabetes component that they carry. And so in one patient in particular that I have, she started with me. Um, she's actually lowered her A1C. She went back to her doctor, and her doctor actually lowered her other insulin. And actually, she called me because she said her doctor told her, call and ask her, can she increase your tirzepatide because your numbers are trending downward. And so she's, trending to a point where she can start decreasing the amount of insulin that she's on, hopefully can get her down and off of the insulin. And so it's really proven to show that it does lower your A1C significantly. And then in conjunction, of course, help with weight loss. So, that's the goal. For diabetics, of course, and to help them lose weight, but also those that are not diabetic that carry that's on that BMI curve of obesity, morbid obesity. Um, it works the same way, of course, with them, but also it trends to help your A1C level still. But the added benefit is you're losing weight.
That's awesome. And
Mm-hmm.
then for some people who may be diabetic, who might think like, okay, am I supposed to be using both of these? It actually is safe to use both
It is.
insulin at the same time.
Yeah. Yeah.
Okay.
Yeah. You just have to be cautious about, where you are. And I always encourage, if they're diabetic, go to your primary care doctor and see if they will, start you on it. So I won't blindly do it, especially for diabetics, because there is, can be a line that you cross that I have to make sure I'm staying on the right side of it. So I always encourage, go back to your primary care because generally, if you're diabetic, your insurance will cover it, one. But this lady chose to go with me because we had an extensive conversation. I sent her back to her primary care, and to say, hey, see if they can get you on this to get your numbers down, but also to help you lose weight. And so after a few weeks, she did go back, but she decided I would just want to come with you. And I said, okay, as long as your primary care is aware, and she's aware.
Are there any side effects that would alert you to say, or to somebody who may start, that would alert you to say, maybe we need to back up and reconsider? So are there things that you need to pay attention to in your body that may not, that may reject the shot?
Yep, absolutely. So one, abdominal pain can be a thing, especially on the left, pancreatitis or, I can share with Steve, he actually had developed some abdominal pain. And so we stopped his shots until, we got further testing to make sure that, it wasn't pancreatitis or any issue of that nature. And so one thing that I always do, I'm very informative. And so before you actually get on the medicine, of course, we talk about side effects, but I also have a consent form that goes over every side effect, possible side effect that you can experience. And if you experience those, you need to let me know. And so they are reading that and they're signing it. And so I make sure I try to go over as well, abdominal pain, nausea, vomiting. Those are common side effects, but if they're experiencing abdominal pain, I want to know more about where the pain is associated with nausea, vomiting. When was your last bowel movement? Because these medicine can slow your digestive system. And so because of that, people get constipated. Some people can experience diarrhea, indigestion. And so, I tell them to try other treatments like a probiotic with it, something like an acid reducer to see if that helped, but stop it for a little bit and see if it goes away. and then maybe lower the dose. So it just really depends on the patient, what's going on with them, and how, kind of which way I need to treat.
And then, Dr. Janze, can you speak to this whole thing of, and I hear it all the time, people keep saying like Ozempic face or Ozempic neck. What does that mean?
So because Ozempic, these medicines they help you lose weight, but they also can help you lose lean muscle mass. And so people kind of get that like agey, saggy looking skin because they're not eating enough protein, they're not doing enough exercising. And so that's why I always push and encourage that and I specifically mentioned, making sure you're increasing your protein because it can help with the lean muscle mass. And so by people just doing the shots and not doing anything else, you start to kind of get that saggy looking skin, face, where your muscle tone is kind of diminished per se, because you're not doing anything along with the shots.
That makes sense. That makes a lot of sense. Okay.
And if I may say, I'm sorry.
No, it's just saying, I never even heard of that, Kim. I'm like, what? Ozempic face?
Yeah, it was a big thing.
Yeah.
Didn't.
So when I had the issue with the stomach, and she told me to go back to the doctor, so I went, and it was interesting because she told me it was actually inflammation. So what happens is when you don't eat enough or you're not eating enough of the right foods, then your body have a tendency to feed off the fat that it has in its body, which causes the inflammation. So that's the reason I was having the problems in the stomach and not realizing I wasn't eating enough, and then again, I don't really have an appetite. So sometimes I have to remind myself that I need to eat because I'm like, man, did I eat today? And so, I get something to eat. So it really is helpful. Right now, I think last time I weighed, I was down 221 holding because I came off a while because of the stomach issues, but I'm still holding at 221, 222. So it's really a help. The numbers or the glucose numbers is still good. Usually when I check it, I don't always check it like I'm supposed to. So, but we ain't gonna talk about that because Doc get on me about that too. But things are going well. Like I said, the fact that it's helping me hold down, and then trying to figure out how I can get back in shape, I guess, or work out. Nothing strenuous, but just to help build back that muscle mass that I have noticed that I've lost a little. But again, it's kind of hard due to bad shoulder and the neck issue. Right now, if you don't know, I'm like fused from level C2 to C6. So none of that moves anymore. So it's really hard, dealing with the headaches and sometimes the stiffness. But I can deal with that because losing the weight, I sleep better, the energy is better. I got two boys and they think they can handle me, but now, they know better now. Even with the bad shoulder, they know to stay on one side of themselves.
So then, Dr. Janze, speaking to some of the, some of the, I guess, like pre-existing conditions that people may have. Like I know some people essentially suffer from sleep apnea. And if someone is suffering from sleep apnea due to weight, is it possible for their doctor to prescribe injections, or would it still be dependent upon other factors?
So it would really depend on their insurance. That's the biggest thing. And that's the issue that we're facing now is that insurance typically doesn't cover. There are still some that will. If you're diabetic, generally you can. Now, most will start you out on Ozempic or Wegovy. But you have, of course, the option of your Zepbound, Mounjaro. And so that's the big issue is insurance. So with sleep apnea, though, that's a whole separate risk in itself. Weight loss definitely can help improve sleep apnea, but it just really too depends on patient makeup, neck size. So it's a lot of other factors that play into that. And so I even patients that I see that are on that have a diagnosis of sleep apnea, I do encourage, yes, you can get on this but again, I always say check with your insurance and see if they'll cover it. If not, then of course, we'll get you on it. But it has the, of course, benefit of losing weight. So when you're losing that weight, that will reduce your risk. But also, some people can still have sleep apnea. It may not be as bad. It may, improve drastically with the weight loss. And so, therefore, people still need to wear like a CPAP machine. And again, not wearing your CPAP, you have sleep apnea that puts a lot of stress on your heart. You're not getting enough oxygen to your brain. So people are tired and fatigued during the day, but also the piece that they don't understand, it puts stress on your heart. So that can cause heart arrhythmias. And so, we see a lot of people that have had like atrial fibrillation because of sleep apnea because it's been untreated. And so it's a lot of things that, can affect your system wide if you're not taking care of yourself.
And my next question, I know you can't speak to the future. We can only hope, but it seems like these weight loss drugs essentially do help with a lot of pre-existing conditions, and ultimately it's almost like insurance will only cover it if you have diabetes.
Right.
But like you said, there's seriousness with sleep apnea, with having a high BMI and cholesterol, things like that. Do you foresee maybe, at some point insurance is doing a better job of making this like a weight loss drug that is approved without people having diabetes?
I'm hopeful. I hope so. But money makes the world go round, right? So, um, in this country we're in, especially now, everything has a question mark. It's questionable. We're not sure what's going to happen. Now, before, it became so popular, insurances were covering it.
Mm.
Yeah. And so this has just been recent. Like there are some that just stopped covering it last year. Um, and so, and there, like I said, again, there are some that are still covering it. I spoke to a lady today who ended up getting like a higher level insurance and they covered it. So, and she's not diabetic, but um, it's just so up in the air and everything, now with the new administration, we just don't know what's going to happen. And hopefully it doesn't get worse before it gets better. I know there are companies that are taking like sugary drinks and sugar-filled stuff out of places, um, options for people, but you still walk and see candy bars, and not a protein shake or a protein bar or the other options, and you're still not offering healthcare or coverage to cover these medicines. So um, I don't know what it, I don't see anytime soon that this will change, unfortunately.
And my other question is, I know, Steve, he was talking about how at one point he was on injections, then he kind of came off and then decided to come back on. Is it safe? Is it okay for someone to say, I want to stop and maybe wait some time and come back on? Like, does anything fluctuate in your body at all?
Yep. So what he talked about, I started him out on semaglutide that had B12 in it. And the side effects was just a little bit too much. And so I switched him over eventually. I took him off for a little bit, gave him a break, just so his body can kind of get back to, some normalcy. And then started him on tirzepatide. And so when he developed the abdominal pain, we stopped it for a while. Um, no negative effects, honestly. The most you have to just really be cognizant of people that have to take a pause for whatever reason is your eating, making sure you're not eating crazy. So depending on how long you've been off of it, determines like what dose I start you back on. So if you've been off of it for 6 weeks, then I won't start you back at the beginning, but I won't start you back where you were before either. And so it's kind of a gradual increase to get you back to where you are. So it just really depends on what's going on, where they are in the stream of their journey, so that we can kind of, and it's really dependent on the person, and I tailor it to each person.
Okay.
With you saying tailoring it to each person, my next question may be hard to answer, but maybe not.
Yeah.
If you experience someone who is kind of like on the fence where they're a little uncertain,
Yeah.
what would be the thing that you would tell them to assure them, like, take a shot? You know what I mean? And I don't mean like take a shot, like take the actual injection, but
Yeah.
take a chance.
Take a chance.
You know?
Yeah.
Yes.
Yeah.
So what would be the thing that you would say to get someone off the fence?
So I want to know why you're on the fence. What's the concern? Is it the cost? Is it the injection? Is it the side effects? Because we can address all that, right? We have a couple of options. So I do really want to understand, like, why are you on the fence, and what have you on the fence? What is that issue that got you that you can't cross over? And maybe it's just you need a little bit more time, a little bit more information, another conversation. And so those people you just have to be patient with, because injections are scary. Medicines can be scary. You just don't know how you're going to react to it. I can never tell you. I can tell you the common things that happen, but I can't say specifically this is what's going to happen. Specifically, this is how much you're going to lose. Specifically, this, you can't do that. And so a lot of people are a little bit nervous about it, understandably so. And so my job is to make sure your questions are answered, and that you're comfortable with whatever decision there is. And even people that are on the fence, that still have some reservation, I'll say, let's start with the B12 shot or my Slim Thick, which has a fat burner component to it, to see how you do with that. Just to kind of get them, a little bit more engaged and, feeling better, because once you feel good, I don't want that feeling to go away, right?
Right,
So
right.
let's keep going to something else. And it's really about building that trust too.
Okay. And Steve, I got a question for you. Because social media will have you feel as if you only see ladies doing this, right? You only see the women that are doing the shot and things like that. So then can you speak to a fella that might be like, hey, I don't know, man. And, I don't see the ladies on the, talking about this on social media and all that. And they don't necessarily look at it as the health benefits as you discussed. They just look at it and see that women are trying to take the shot so they can lose weight and none of the other stuff. So speak to it like as your advice from another brother who may be looking to do this as well.
That's interesting you asked that, because I had an associate that actually has started. And I seen him, I was like, oh, so you started. And I could really tell a big difference in his size. I could tell he started to slim down. He started because he liked food. And I was like, man, that's like, you give up the healthy part for the food. But, it is to each to his own. But for the fellas, man, my thing is it has a lot of other benefits, especially if, you're struggling with weight. You work all the time. You've had injuries. I know a lot of guys that had sports injuries. They put on their weight and it's hard to get off just because of those injuries. So they can't really work out like they used to. They can't get out and run, or they don't walk. They're just not motivated to. I would say with the losing other weight, it has a lot of benefits to it. For us men, it really does help your libido. It gives you that extra drive. So you feel better. If you're not sleeping well because of your weight, like she was talking about with sleep apnea, you may not have been diagnosed with it, but if you have issues breathing, you're waking up tight, that could be one of the things. But I know personally that weight has a lot to do with it. So if you're struggling with that and you need that help, this help get you over that hill, so to speak. So it's just one of those things, you have to do something. Men, we are bad with going to the doctor, and we don't really tell people, hey, I need some help losing weight, because we figure we can do it on our own.
Right.
It doesn't hurt to get that little extra assistance, because like I said, I seen it in my clothes before I seen it on the scale. It's like, man, I don't feel like I'm losing no weight, but then I put my clothes on, everything fits different. I was wearing size 40, and now I wear a 40, it just sags off me. And I refuse to buy any clothes right now because I'm still losing. So I hate to buy, go down to a 38, which would make me feel good. But, to buy those clothes and then have to buy again, it would be crazy. So if you have those clothes that you went up a size and you need that help, this definitely helps. And I'm not just saying that to help sell something.
Right.
It really made a difference. It helped me feel better. And like I said, being diabetic, man, we have to be selective about what we eat anyway. and this helps.
Mm-hmm.
My biggest problem is not eating enough, but then when I did eat, I wasn't eating the right stuff.
Right.
So, if you are having that issue as the guys, man, listen, it's worth it. Your health is worth it. I'm sure your family feel like you're worth it.
Mm-hmm.
And I hate to sound cliche, but what do you have to lose other than weight?
Right. Good answer.
And Dr. Janze, I want to ask you about some of the side effects. I mean, we know that some of them can be like nausea, heartburn, things like that. What are some things that if a person is experiencing nausea or heartburn, what can they do to alleviate that while they're on the injection so they don't have to stop?
Yeah. So for a lot of patients, I do offer Zofran, which is anti-nausea tablet. You just throw it under your tongue, and it dissolves, and really it works in like 15 minutes. So semaglutide is known to have more side effects than tirzepatide. You can still have side effects on tirzepatide. And so I give those, just, and I tell them take it. Generally, those side effects, though, is like the first 24 hours after your injection. Usually it doesn't last for days on end. What you eat can cause that. But some more natural things is eating smaller amounts, drinking more water, because sometimes if you're dehydrated and you're not eating enough, your blood sugar is low, it can make you feel nauseous. So eating smaller meals, drinking lots of water. Ginger is actually a good natural to help with nausea. Some people might like a peppermint or something. And so, I do encourage that. But I also, like I said, give patients that come, I give them, some Zofran to help, if they need it. The other thing I have found success in too with semaglutide is lower doses in the beginning. So if I'm titrating their doses up a little bit, start them out with a little bit lower dose just so their body can get used to it, and then increasing it. Um, I've had people have more success with the side effects. Still may have it a little bit, but it's not as bad as if we start with this larger dose. So that's one thing that I have started to see and learn as I'm doing this, even in my practice. But also as far as the constipation, of course, it's a big side effect. Any stool softener that's worked for you, I encourage that. Miralax, I always say, because you can throw it in anything and not have much of a taste to it. And so and it's safe to do with anyone. You can put it in your drink, your water, like every night and drink it. And then, you have a good BM. Lots of fluids definitely will help with the side effects of nausea, um, and constipation, moving, because we're getting your body moving and all that. So that can help too. But then with the indigestion that people experience in the beginning, um, I do what they call PPI. It's like an acid reducer every day anyway, because I've had H. pylori. But I do encourage, if you have like some indigestion, which some people experience, especially in the beginning of taking it, Tums can help, Rolaids. You can still do like the Prilosec or Pepcid. Um, those kind of acid reducer type medicines can help alleviate that. But then over time, that gets a little bit better too.
So you have a question also. Does the trizepatide adversely affect moods?
It can, when they did the clinical studies on the manufactured drug, and I say quotes because that's what the study they did on. But there is a piece in there that talked about mood. It can affect people's mood. So it's important to understand people's history. And so depression, anxiety, like suicidal ideation, if that increases while you're on it, you need to let the doctor know so that we can take you off of it, because of course that can be a side effect of it. It can be rare, but it has occurred for people. So it's just really all too about making sure you have a good history on patients. And there are actually people that cannot be on it. Type 1 diabetics, it's not recommended for, um, it's not prescribed for them. Although I have heard that people are on it. because it really helps lower the A1C, and that's the big issue that they have. But also, oh, I lost my train of thought. I'll come back to it in a minute. I can't think of what I was going to say. But either way, um, the mood, yes, it can affect your mood. It can. It's probably rare, but it can be one of those things. Oh, when I talked about who can't take it, people that have had like certain types of thyroid cancer or have had a family history of it, just because it can affect that. So it's important that people understand your medical history, your labs, baseline labs, or somewhere to know exactly whether you are able to be treated or not. But even if we do treat you, watch out for those symptoms or side effects.
Are there any medications that cannot be combined with the injection?
There are some, a few that are absolute no-nos. I would have to look at the list, but generally, people that are on it, you can be on it and have other medicines too. You just have to watch. Sometimes the potency may not be as great on it, but there's like a kind of like may interact with certain medicines,
Mm-hmm.
but nothing that would be harmful, I would
Mm-hmm.
say.
Mm-hmm.
Um, Yeah, and there's a list, especially when you go to the website for Wegovy.
Okay. Okay.
Hmm.
Awesome. Okay. And I guess that we pretty much wrapped up everything. I'm like, geez, all right, flying through it. But I do want to highlight once again your membership program, because I do know that some people oftentimes won't move forward with injections because it's like, well, man, my insurance won't cover it, so I can't afford it. But what we really want people to understand is that the cost of what it would be for, for your practice in your office is far more affordable than what it would be if they were just to go to their pharmacy.
Right.
And given as though that the cap on, drugs have been risen,
Yeah,
it would be even more expensive than what it was a couple months ago. You know,
absolutely. Yeah, it's actually pretty mind-boggling the cost that I've heard. I've had someone tell me that the Wegovy that was prescribed by their doctor was about $1,000 for 4 doses.
mm-mm.
And I was like, "Well, I can get you more than that, more months for that cost." And that's why I revamped the weight loss program, because it's important for me, and it's important that I help the community, get this weight off so that we can be our best and healthier
Mhm,
selves.
mhm.
Monjero actually, or Zepbound, the cost is even greater
Mhm.
per 4-week supply. And so it's actually, the prices are astronomical.
Exactly. And when you think about investing in your health, you know, it
Yes.
it should be a no-brainer,
Right.
because the thing of when you do your breakdown, and I want people to understand that when you do go to Dr. Jan, it's a very transparent conversation of, what the dosage is going to be, how long you're going to be on it before you move to the next stage,
Yeah.
how much it's going to be. But the price that you're getting is for the entire month, which means that you're going to get, for at least 4 injections, depending on how much of the medication that you're injecting yourself with. Um, but if you're going to invest in, perfume, purse, shoes, things like that,
Yeah.
you can invest in your health. You can 1,000%, invest in your health and make sure that you're taking the steps necessary to get this weight off, to get healthy, and also prepare your body now, because summer bodies are made in the winter and
Yeah.
not in the summertime. So let's start making these changes now, and don't wait until
Yeah.
it's too late.
Yeah, absolutely. And like you say, I am very transparent, and I tell people this is a no, don't come in feeling, ashamed. We listen, I'm meeting you right here where you are, because that was me. And this is why I'm doing what I do.
Absolutely. And I think it's
Yeah.
important for people to know that,
Yeah.
that, the reason why you do this is because you have a strong connection. Like you said, you've been in this place where you've battled with your weight, and a lot of us have,
Yeah.
up and down, even like Steve said, where you're starting to realize that, look, like I'm no longer at my ideal weight. We gotta make some
Right.
changes here.
Especially when I looked at my chart and it says obese woman or morbid obese, and I'm like, I ain't that big. But according to the BMI, I am. And my doctor even called out like my blood pressure. My blood pressure is usually like 128, less than 130. And I went to the doctor and it's like 120. Usually it's like 109 to 117 or something. And I went to the doctor and she was like, your blood pressure is going up. And I'm thinking like, well, I'm still in good range because it's 128.
Mm-hmm.
But when you look back and you see how I was trending, yeah, my blood pressure is scaling up to the point where I don't need it to.
Exactly.
And we have a lot, as African Americans, you have your family history, your genetics, things that you can change and things that you can't change. And so let's work on the things that we can change
Mm-hmm.
because it's time to break that cycle. It's time to live better and healthier lives. Don't walk around being cute when you are slowly killing yourself on the inside.
Hello.
Let's be cute inside and out.
Hello, and let's talk about that Uber driver that was out here talking about, oh, I'm just a little big bone. No, girl, you're fine. Okay. Like, let's not play these games. You're big.
Hey, some of us like them big boned.
So, and for those that, my doctor just recently put me on the Mounjaro shot. Is that how you say it, Mounjaro or whatever?
Yes.
Mounjaro.
I don't know, whatever it is. One of those.
We got
things.
you. We got you, coach.
Yeah. So, if it wasn't for my insurance, I would be paying $1,600.
Wow.
And that's only for 4 shots.
Yep.
Wow.
That is insane. That is rent.
Yeah.
Mortgage.
Luckily, I have insurance that is paying it, but if I did not have insurance, I was trying to look it up. I knew Walgreens would have my information on the app, and it literally says my insurance paid $1,638 to be exact.
Sheesh.
Wow.
So,
wow.
If you don't get it from your insurance, then just know that that's the prices that you're looking at.
Right.
And another thing for the guys, especially those that work out, before you walk in the gym, old saying, and I don't know if they still hold by it now, but check your ego at the door.
Yeah.
It's about longevity and being there for your family.
Absolutely.
Mm-hmm.
Absolutely.
Yeah.
Why did I call
and
it
Mounjaro? And I want to encourage people, don't be afraid to take these, to come and get help, because sometimes we need help and it's not to be ashamed. You see a lot of people that are doing things and, a lot of people are on these shots and they won't tell you. And that's okay. And that's okay. But also know that you have to do what you have to do for your health, because nobody's going to take care of you like you take care of you.
Mm-hmm.
So don't worry about naysayers and what. No, do what you got to do to take care of you.
Exactly. And I'm glad that you mentioned that, because there is a lot of stigma behind people being on the injection. And a lot of that is from social media. But like you said, there's a lot of people on these injections, and that's okay. There's nothing wrong with that.
Nothing at all. I have felt so amazing being able to get this weight off, because otherwise, after my hysterectomy, I gained probably about 15 pounds. I was at 234 pounds. I've never been that size, even after having 3 boys that are like 8 and 9 pounds. Never. And so this has definitely been a game changer for me. And that's why I really want to help people, So look me up.
There we go. And how can they do that?
They can find me here on social media. So Facebook at embodyhydration.com, Instagram at embodyhydration. You can also go to my website, newly designed, at www.embodyhydration.com. Schedule your weight loss consultation. We can do it in person or virtual. So,
boom. Look at there.
And Steve, thank you for coming in and talking and actually representing the bras doing this, because that's
absolutely, man, absolutely. She had posted a picture on Facebook one time. I had went in to get a drip, And it was one of them days, man, I was just drained and went to sleep. So fortunately I had a mask on, because if not, you'd have seen my mouth wide open. But you know, guys were like, hey man, you doing that for real? Does it really work? Like, it helps me.
Yeah.
All I can say is try it. If it don't work for you, then you know what works for you and what don't.
Right.
But I will say, you know, with losing the weight, man, it's helped me a lot. It really has.
You hear it. Get on it.
Yes, sir.
So we want to thank everybody for joining in on today's show. It is 8:00. And for those who are here in North Carolina, please be safe tonight. If you're out there on the road and you got to go to work and things like that, and also be safe in the morning, because the temperature's dropping. So everything is going to be ice in a little bit. And I don't know, Kim, are we doing virtual again tomorrow?
We may, but we will let you guys know.
Okay. So yeah, we will let you guys know. And then Dr. Janze will be back with us again next month. But please make sure you follow and see all the information that she has on the social media, and make sure you get in contact with her. And yeah, that's it. So this is TDS Radio. Go ahead.
Hey, no, I was gonna say, man, next time you gotta change that hat you got on your head, though. We can't be having all that.
Bye, Steve.
So this is TDS Radio. Our voice, our culture. We'll see you tomorrow.